study for the test. Without further ado, here we go. COPD. What do you want to remember related to COPD? Oftentimes, when we try to focus on the pathophysiology, we try to focus on things that are easily remembered from our lessons in the past. But remember, the NCLEX is kind of tricky. Sometimes it would ask you questions that you would be caught unaware. Okay, so two things I'd like to highlight related to COPD. First, the diet has to be high calorie and high protein. Why? Because they needed extra energy because of their dyspnea. Second, you have to focus on the symptoms and you have to know which symptoms are indicative of worsening of the patient or symptoms that are indicative of the development of complications. For example, if a patient has COPD and then the patient develops sputum, that indicates that the patient would have developed pneumonia, and that is fatal in elderly patients with COPD. Second, if the patient develops confusion and asterexis or flapping tremors, this indicates respiratory acidosis, which is also a complication of COPD, and that is due to the retention of carbon dioxide. That needs to be reported to the physician too. And of course, when there will be swelling of the fingers or swelling of the feet, okay, the patient would usually manifest together with the swelling, shortness of breath, plus lightheadedness. So those three things, swelling of the feet, shortness of breath, and lightheadedness, that would tell you that the patient could be developing your cor pulmonale, which is right ventricular hypertrophy. That is also a complication of COPD. So remember those two things, the diet and symptoms that are indicative of the patient's complications. Next, let's move on to the functional concept. A client with COPD should be provided with high calorie, high protein diet. They would need additional energy because of their dyspnea. Next, you have your Alen test. This test is used in order to assess for the circulation of the specific area where a specimen is usually gathered before an arterial blood test analysis of the blood that's obtained in the area is performed. So now, how do we perform the Alen test? Some literatures would call this modified Alen test. So remember the code F-core. F means first ask the client to make a fist, like this, and then you need to, the next step, letter C, compress the radial and the ulnar arteries. So, which simply means you will need to occlude it in order to decrease the blood circulation in the area. And then you ask the patient to, once again, open the fist. Okay. And then the last step is R, release the ulnar compression. So when that happens, note that within 5 to 10, or some literatures would say 15 seconds, the pink coloration of the area should come back. So it simply means that there is adequate circulation in the area. So once again, F core. Make a fist, compress, open, then release the ulnar artery. Once again, fist, compress, open, and release. Of course, when you're doing that, the hand should be laying flat on a table. Okay? So that's how you perform the Alen test before obtaining your specimen for ABG. That area is not a good area to obtain the specimen. So you call that a negative Alen test when the palm remains pale. However, if the palm immediately has regained its pinkish color, then that simply means that the circulation in that area is not impaired. So therefore, it's a good area to obtain your specimen. So once again, palm up. Okay, let's do it on the other side. Then ask the patient to open, close, then close, close, and then press on the radius and the ulnar artery. Okay. Then ask the patient to open the palm, release the ulnar artery compression, and note if there is change in the color of the palm normally should turn pinkish. Okay, so remember the Alen test is performed before a specimen for a period blood gas analysis. Remember, it's used to assess collateral blood flow to the hands. Next, cystic fibrosis. Now, the main problem in cystic fibrosis would be the production of thick and sticky mucus. Primarily, it affects two systems. So there's going to be obstruction of the airways. So you need airway clearance therapy, and that would involve uh, positional changes to promote drainage of the secretions from the lungs. So that's facial therapy, plus the administration of albuterol to promote dilatation of the airways and pulmozyme to thin the mucus. Next, your cystic fibrosis could also affect the ducts in the pancreas, the liver, and the intestines. So it's very important to administer pancreatic enzyme. The pancreatic enzyme, pancreas, must be taken with each meals and snacks to promote digestion of fats. So in a patient with cystic fibrosis, the diet should be high sodium, high calorie, and high fat. Why does it have to be high fat? You need to replace the fats that the patient is excreting in their stools because those fats remain undigested. Okay? So remember, the pancreatic enzyme given to a client with cystic fibrosis must be given with each meals and snacks. So every time the child eats. Okay? The second thing that you have to remember, you have to learn how to use technology as you prepare for next generation NCLEX. But the lectures alone will not work because the test is high-tech. And then paper-based questionnaires will not work if it's the only thing you're doing because the test is high-tech. You have to learn how to navigate the questions properly. And here at the Gapuz system, we have internationally published learning tools. Plus, we have our own course shell where you can navigate to the different types of questions on the NCLEX. And the third, you need a conducive environment that should keep your focus. So this is our nclex-pn simulation at the Gapuz building, second floor here at UN Avenue, Manila, Philippines, and of course, our very intimate class that would facilitate learning in a very conducive environment. So, may I invite you to join us for our next generation nclex-RN Flex, the most flexible test prep class for the nclex-RN. The fee starts at $3,499. You have a choice of live face-to-face class, live virtual class, on-demand and limited video recorded lessons, QBank plus the 3 books, plus the NGN strategies with me and my quick fix session. So give us a call, 0906-201-9383. So this is your mentor, your fact check buddy saying, Ray Gapuz, okay, a functional concept a day keeps your nclex-RN fears away. See you in my next video. Is what do I need to study for the test? But that should be answered by an expert who knows the ins and outs of the test, not just by some false nclex-RN prophets. Okay, so let's begin. Glaucoma. Now, pay particular attention to the fact that in glaucoma, there is increased intraocular pressure. Usually, the treatment would involve administration of drugs like pilocarpine that constricts the pupil so it allows outflow of the excess aqueous humor. There are also drugs that are considered as contraindicated, and these are the drugs that could cause pupillary dilatation. The most common ones is actually your atropine sulfate. Okay, so if atropine sulfate is prescribed for a patient with glaucoma, you need to question the physician's order or clarify the physician's order. And if the patient will undergo eye examination and there's atropine eye drops, ophthalmic eye drops that is ordered by the physician, make sure that you need to check that the patient is not suffering from glaucoma because your atropine will further increase the intraocular pressure as it causes pupillary dilatation. Okay? Remember, atropine is contraindicated in a client with glaucoma. Next, discharge priorities. Now, during a disaster in which additional beds will be needed, so you need to discharge patients so that you can accommodate the increasing number of clients who are injured because of, say, for example, an earthquake, a fire, or there's a calamity that has increased the number of persons who are injured in a specific area. So, to make way for a vacant bed during major disasters, consider discharging the following patients: those who delivered 24 hours ago by normal spontaneous delivery, those who are due for discharge within the day. So, if they are due for discharge in the afternoon, you can discharge them in the morning. And those who are done with the diagnostic test and they are not bedridden. So, they are done, like for example, if undergone ultrasound, those patients are not bedridden. But patients who have undergone lumbar puncture, they need to be on bed and they should lie flat for 6 to 8 hours to prevent spinal headache. You cannot discharge them right away. So those who are still having diagnostic tests and they are having a diagnostic workup for a specific disease condition that the doctor is ruling out, if they are done with the diagnostic test, then you can discharge them too. Okay? Next one would be your celiac disease. Now, in celiac disease, there's a potential development of intestinal villus atrophy. So, instruct the client to avoid barley, rye, and wheat. Oats can already be given. And triticale, which is a hybrid of your rye and wheat, should also not be given to a patient with celiac disease. The patient with celiac disease may also need to inform their priest if they're already having communions that they have celiac disease, so we can reserve your wafers, communion wafers that do not contain either your barley, rye, or your wheat. And then cosmetics should also be checked for the potential content that could be associated with either a barley, rye, and wheat, especially those who are fond of using lipsticks. Now, corn, cassava, and coconut are considered gluten-free for as long as they are raw. Okay, pasta, pretzels, pizza, pastries are not gluten-free. So anything that is baked, that's commercially prepared, these are usually not considered gluten-free. Cakes, cereals, cookies, and crackers are not gluten-free, especially your canned cereals. These are commercially prepared, and some additives are actually given in mixed with these products. Now, for patients who are asking you if potatoes are considered gluten-free, those that are raw are considered gluten-free, but baked potatoes are not. So you have to be very, very specific with your instructions. And of course, the second thing that I'd like to remind everyone is you have to know how to study using technology. Now, the next generation NCLEX now would ask you to navigate through the different types of questions such as bowtie, case studies, matrix, and if you are not adept with using technology, then there's nothing. So your test preparation should be something that would include the use of technology. Here at Gapuz System, we utilize technology that are unique to our system, and even our teaching and learning tools are published by international publishing companies. So the latest technological tools that we have is your Gapuz for shells. Now take note, it covers all the subject areas in the NCLEX-RN, and you have a choice to either watch a video, take short quizzes, long exams, or just focus on the next generation NCLEX items. We have the most number of NJN items in our course shell. And of course, the third requirement is be in a conducive environment. This is our NCLEX Next Generation Simulation Room at the Ray Gapuz building here in Yun Avenue in Manila. And this is our very intimate class, very comfortable when we conduct face-to-face classes. So may I invite you to avail of our next generation NCLEX-RN Flex, the most flexible test preparation class for the NCLEX-RN that includes live face-to-face classes or virtual classes or on-demand and limited video recorded lessons, Cuba, 3 books, and of course, the next generation sample questions strategies with me, plus my quick fix session. So the fee starts at 3,499. Give us a call at 0906-201-9383. So you can choose either weekday classes in the morning or weekday classes in the afternoon, or just exclusively weekend classes, either morning or afternoon. So this is your mentor, your fact check buddy, Ray Gapuz, saying I'll see you in my next video. Take note, a functional concept a day keeps your nclex-pn fears away. See you in my next one. First question that you should ask yourself is, what do I need to study? Here we go. I will make this simple and short, okay? So Parkinson's disease. What are the things that I'd like you to remember for Parkinson's disease? Focus on the symptoms, but take note, you have to know the descriptive version of the signs and symptoms as presented here. Like, for example, mood changes could be the same as irritability. Overstood posture could be described as the patient seems to be moving with the upper body faster than the lower body. That's overstood posture. Rigid muscles or cogwheel rigidity. It's very difficult to turn cogwheel. Expressionless face or apathy. Bradykinesia or slow movement. Automatic movement loss. There's no blinking, no smiling, no arm swinging when they walk. There's also drooling or excessive salivation. And then there is dysarthria, difficulty in using the muscles of articulation. Excessively clumsy, so there's clumsiness, and they have aching muscles, bowel and bladder incontinence, and of course, your tremors that are considered resting or pill rolling. Initially, it will just affect one hand, and then eventually both hands will be affected. And then the speech changes. Eventually, the patient's voice would be soft and monotonous. So they could be slurring too. So the monotone voice could be associated with the underlying depression that occurs in the patient. Okay? Second, remember that levodopa is the most effective drug for controlling the symptoms of Parkinson's disease. However, instruct the patient to avoid protein-containing foods like fried chicken, because that will decrease the absorption of levodopa. And the first symptoms that you will note when there is decreased absorption of levodopa is that the pill-rolling tremors will become worse. Okay? So levodopa should be administered with a low-protein diet or avoid vitamin B6. Do not confuse it with the INH, because in INH, that's your anti-TB drug, you need to administer the medication with your vitamin B6 in order to prevent peripheral neuropathy. That's for the INH. However, in levodopa, you have to instruct the patient to avoid protein-rich foods because it contains your vitamin B6 that will decrease the absorption of your levodopa. So pay particular attention to that difference. Okay. Now, levodopa is usually best taken with meals or after meals if there's GI irritation. But for best absorption, it can be taken 1 hour before meals or 2 hours after meals. Remember, you can take it after meals if there's GI irritation. Now, your frontotemporal dementia or Pick's disease, remember it affects the fronto and then the temporal area, frontal area, temporal area. So your Broca's motor speech area is affected, the part of the brain that deals with personality is affected, temporal area deals with hearing as well as comprehension. Therefore, in frontotemporal dementia, the parts of the brain that are responsible for personality, behavior, and language shrink. So therefore, the manifestations could be changes in personality, patient's behavior, and their ability to comprehend. Here we go. What are the common behavioral symptoms? Remember the code, lapse. Lack of inhibition, judgment, or empathy. So they are unable to empathize. Sometimes they walk naked because they lack inhibition. They have apathy or expressionless face or emotional blunting. Personality changes. Usually this is manifested in their inability to maintain personal hygiene. Then the lips would usually be smacking, and they will have compulsive behavior. And then they will be eating inedible objects or excessive sweets. Speech and language, you have talk, calligraphic speech, aphasia, both expressive, meaning inability to find the right word to say. So you need a communication board or a picture board, such that when they need a glass of water, they just show the picture board to show what they need. Receptive aphasia is inability to understand. So talk to the patient slowly. Then loss of ability to know word meanings. So they are lost for words because they are unable to recall which appropriate word to use because they have forgotten the meanings. And then knowledge of word meaning is lost. And then, of course, you have your movement disorders. Now, this is how your frontotemporal dementia differs from Alzheimer's disease. In Alzheimer's disease, you don't have Parkinson-like symptoms. In Pick's disease, you have Parkinson-like symptoms, apart from the symptoms of dementia. Another difference is frontotemporal dementia occurs earlier than Alzheimer's, which usually manifests when the patient turns 60 and above. Another difference is a patient with Alzheimer's disease would usually have very, very poor memory that is progressive, which means once their memory becomes bad, it doesn't go back to normal levels anymore. In frontotemporal dementia, the memory loss is fluctuating. There are days in which the memory of the patient is good. There are days that it's so bad. And then the patient with Alzheimer's disease would usually get lost even in familiar environments. For example, they get lost even in their own home. Whereas a patient with frontotemporal dementia, you don't have that. So they don't get lost in familiar environments. So those are the similarities and differences between your Alzheimer's disease and Pick's disease. So in Pick's disease, you have, remember, tremors, similar to that of your Parkinson's disease, rigidity, similar to Parkinson's disease, underactive or difficulty swallowing, once again, similar to Parkinson's disease, muscle weakness and mood swings, and of course, poor muscle coordination like clumsiness, similar to Parkinson's disease. So currently, antidepressants are given in order to reduce the symptoms of frontotemporal dementia. So for a patient with frontotemporal dementia, you need to prioritize, take note, it's still a cognitive problem, so the reorientation of the patient. That's a level 1 priority. Second level priority would be promoting the patient's safety. Remember, that's in order of priority. Cognitive needs followed by safety needs. The second question is, you have to learn how to study using technology. Okay, how do you do that? You have to engage in a teaching and learning session that would allow you to use technology. Here at RA Gapuz Review System, we have our own tools published by internationally renowned companies, and our latest technology tool product is your RA Gapuz course shells, covering all the subject areas on the next generation NCLEX. Plus, you have a choice whether you want to have short quizzes, you want to just answer NGN questions, you want to be familiarized with standard NCLEX questions, and this would also give you an opportunity to focus on the things that you need to remember for your test. And of course, the third, you have to be in a conducive environment that would allow you to have that real life experience. This is our Ray Gapuz NCLEX simulation room, found at the second floor of the Ray Gapuz building here in UN Avenue. And of course, our very intimate face-to-face NCLEX RN classes for the next generation items. Okay, so may I invite you to join us in our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. The fee is very reasonable, starts at $3,499. The fee includes, take note, review books, that's 3, the use of our QBank, and your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, plus next generation NCLEX RN strategies by me, and of course, quick fix session. So give us a call, 0906-201-9383. So this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day keeps your NCLEX RN fears away. So join our teaching and learning session and enjoy the class with me and pass the next generation NCLEX the easy way. Important question that we need to address today would be, what are the things that you need to study? Of course, you need an expert opinion, and we shall begin with the things that I want you to remember for your test, and that is beginning with percutaneous ventricular assist device. As you can see, in a percutaneous ventricular assist device, you have a mechanical pump, okay, that is outside the body, okay, and this pump supports the heart. So that's in a nutshell how you should explain it to your patient. So the pump is actually outside the body. It's a mechanical pump, and it is the one that supports the heart in order to contract properly. So this device is indicated for patients with chronic heart failure and those who are waiting for heart transplant. Okay. You would also note that the control system is actually on the abdominal wall, and the communication between the control system and the pump is through a catheter. So this is a catheter, and the catheter could be either inserted on the neck, the armpit, or the leg. Okay, now, so what are the things that your patient should know about this? First and foremost, how should the percutaneous ventricular assist device affect activities of daily living, particularly taking a shower? Of course, the patient can take a shower, but you have to tell them to ensure that the control system does not get wet. And the most important thing that you can tell your client is they can actually engage in sex, okay? They can travel, they can go hiking, they can ride a bicycle, they can go biking. However, they should not engage in water sports or swimming, as it will soak a control system. Now, since you have a connection from the outside of the body to the heart directly, the danger is when infection sets in. So remove anything that is wet that could potentially introduce bacteria into the access port, because that could directly spread the infection into the heart and the circulatory system. So if the patient experiences fever that is above 38 degrees centigrade or 100.4 degrees Fahrenheit, suspect infection, and that needs to be reported. Also, it's important to tell the patient to check the device every day to make sure that it's not going to malfunction. And then the patient should also be monitored for bleeding, because the patient will be on a blood thinner. Even if the patient is on a blood thinner, they still are at risk for developing stroke because of clots that could potentially form from any part of the percutaneous ventricular assist device. So once again, this device is for patients with chronic heart failure and those who are waiting for cardiac surgery. Okay, next, we have your oxybutynin, which is a medication that helps relax the muscles. So it would help decrease muscle spasm. Usually this is used as a form of treatment for patients with loss of bladder control. Now, one of the things that you have to note for patients taking oxybutynin would be your vital signs, specifically the heart rate, as this medication potentially would increase the heart rate. So this can potentially worsen your hyperthyroid patient. Okay, so the heart rate is very, very important for you to monitor. Now, what are the common side effects? The typical GI side effects could be diarrhea or constipation, and then heartburn. Now, how would you know that you need to report some symptoms that the patient might be experiencing when the symptoms may indicate overdose of the medication? And this would usually be CNS symptoms. So when you talk of CNS symptoms, you have central nervous system symptoms, you have confusion, dizziness, hallucinations that indicates overdose of the medication, plus flushing of the face, like Redman syndrome in a patient taking vancomycin, or the niacin flush in a patient who is taking niacin, which is your vitamin D3.
Okay. And of course, you have your meconium aspiration syndrome. Now, this is common among full-term babies or post-term babies. This can be fatal, but most of those who have this eventually would fully recover. So, how would you know that the baby is in danger of meconium aspiration? So there's usually brownish or greenish amniotic fluid. This is what we call meconium stained amniotic fluid, and there's going to be slow heart rate. So when the child is at risk for meconium aspiration syndrome, you have to refer the client immediately to the neonatal resuscitation team, which should be on standby. And then you would notice that the baby could be limp. Okay. There's bluish discoloration of the skin, and then usually the breathing could be irregular. So the two priorities for meconium aspiration syndrome would be suctioning, making sure that the upper airways are suctioned, the lower airways are not necessarily suctioned, not unless it's indicated or ordered by the physician, because it could potentially um, stimulate the vagus nerve that would potentially decrease the heart rate. And the second priority would be oxygen. So in essence, you're ensuring a clear airway by suctioning the patient and then administering oxygen. Now, the second important thing that you have to know should be the NCLEX now requires you to navigate technology-based questions. So you have to know how to navigate those. And the best way to learn is through our learning tools at the Gapuz system. You have NCLEX 311, which is the local title of the NCLEX RN in a flash that's available in Jones in Bartlett, USA. And of course, our state-of-the-art course shell. You can navigate through any of the course. This is very, very easy. If you may want to study infection control, basic care and comfort, health promotion and maintenance, management of care, okay, pharmacological and parenteral therapies, physiological adaptation 1, 2, and 3, reduction of risk potential, and of course, psychosocial integrity. This is your best bet for passing the NCLEX. And the most important thing, you have to be in a conducive environment that should keep you in focus when you're preparing for the NCLEX. So this is our NCLEX class, which is very, very intimate. And we have our own NCLEX simulation room, and we have our own hall where a limited number of participants are allowed to join us at a time. So if you would want to join our NCLEX Next Generation NCLEX RN Flex program, the most flexible test prep class for the NCLEX RN. The fee starts at $3,499. Give us a call. You have a choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons. You get the chance to have our course shell, the Q Bank, 3 free books, and of course, my NGN strategies, plus the 3 days quick fix sessions that are conducted every month. So I'll see you in my next video, and I'd love to see you join my quick fix session. Once again, this is your mentor, your fact check buddy, Ray Gapuz, saying, be the next USRN with a functional concept a day that keeps your NCLEX RN fears away. Yourself when you're preparing for the NCLEX is, what should I study? The key is get an expert opinion. So whose expert opinion would you need? Here's mine. Here we go. So one of the things that a lot of you would fail to remember for the NCLEX would be, when do you need to refer a client to a registered dietitian? Now let's differentiate a registered dietitian from a nutritionist. These are two different individuals. The nutritionist, by definition, is not necessarily professional. Anyone who knows about food can claim to be a nutritionist. Therefore, the acknowledged member of the healthcare team is the registered dietitian, not the nutritionist. Now, the basic question is, who should we refer to the registered dietitian? Now, there's a lot of confusion related to patients who are post-stroke, the elderly patient, patients with dysphagia or dysarthria, because patients with dysphagia or with dysarthria, they need to be referred to a speech language pathologist who would help them with exercises that will loosen their muscles of articulation. Now, if a patient has dysphagia and they have conditions of the GIT, like for example, they have colostomy or ileostomy, or sometimes NCLEX is very indirect. Instead of putting in the options, a client with colostomy or a client with ileostomy, they would say a client with Hirschsprung's disease. Why? Because one of the cornerstones of management for clients with Hirschsprung's disease would be that the patient will either have temporary or permanent colostomy. So which simply means a client with Hirschsprung's disease needs to be referred to a registered dietitian. In the same way that a patient with ulcerative colitis needs to be referred to a registered dietitian, a client with cystic fibrosis, because they will need high calorie, high sodium, and high fat diet, because you have to replenish the fats that they are not absorbing and they are excreting in their stools. And then definitely a client with dementia must be referred to a registered dietitian. Now, take note that if a client with dementia would usually die, the patient or the relatives, specifically including the nurse, could potentially be emotionally affected, and that's what we call disenfranchised grief, when the grieving is not as what society expects it, or when the grieving is associated with an illegitimate or unaccepted relationship. Like, for example, the death of a mistress, the death of a boyfriend who is an addict, or the presence of divorce. Those could trigger disenfranchised grieving. Okay. Once again, you have to refer patients with gastrointestinal problems or pathological conditions to a registered dietitian. The patient with dysarthria and dysphagia should primarily be referred to a speech language pathologist. I just hope I was able to clarify that confusion. Next, niacin or vitamin B3. So it helps convert nutrients to energy. So this is needed especially by elderly patients. However, there are side effects that we need to focus on. And when we speak of side effects, it's the GIT that's first to react. So focus on diarrhea, bloating, and of course, the so-called niacin flush, in which there's redness of the face and then the chest, like the Redman syndrome in a patient taking vancomycin. Now, you have to keep watch of the dose, because when niacin is given at a dose that's more than 30 milligrams, eventually the patient may experience rashes as well as pruritus. So the patient could have allergic reaction, and that niacin can have the potential to worsen diabetes mellitus. So discharge instructions for the patient who's taking niacin, so we have to tell them to avoid taking alcohol and avoid rapid position changes, as the patient may potentially experience orthostatic hypotension. So specifically, this is needed when you have elderly patients who are at risk for falls. So we need to tell them to dangle their legs first before trying to stand up from a lying down or a sitting position. And of course, you have your rivaroxaban. Okay. Now, this is your Xarelto. It's an anticoagulant. It's given in patients with deep vein thrombosis or pulmonary embolism. Now, take note. If the patient has already deep vein thrombosis, they're given anticoagulants to prevent enlargement of the clots. But to prevent deep vein thrombosis, the patient may be put in sequential compression device or pneumatic compression device, which should be worn 24/7. And when they need to go to the bathroom, they need to remove it because it increases the risk for falls. However, when they remove it, they have to make sure that it is within a time frame of less than 2 hours. Because if they get to remove it 2 hours or more, then they will need to obtain doctor's order before applying the pneumatic or the sequential compression device once again. So your rivaroxaban is actually an anticoagulant. Now, there are studies that says that it primarily prolongs the prothrombin time and it doesn't have an effect on the PTT. However, there are also literature that highlights that we need to monitor both the PT and the PTT. Okay, so most importantly, therefore, you have to check your PT, prothrombin time, and your PTT, your partial thromboplastin time. Okay, however, the most important thing that you need to check if your patient is going to take rivaroxaban is their kidney function. So primarily focus on laboratory tests such as your BUN and creatinine before the treatment begins, and then at least once a year as they are taking the medication, for example, for a prolonged period of time. Okay, so the second question again, how do you study? The NCLEX is asking you to navigate technology-based questions. So you have to be exposed to technology that are aligned with your thinking and learning process as an Easterner. So I'd like to invite you to check out our learning tools, NCLEX RN Flash, available in Amazon. And of course, the local title is NCLEX 311. And of course, one of our latest innovations, your course shells, which would help you navigate through the different subjects of the NCLEX RN in a very, very easy manner. And of course, you have to be in a conducive environment that should keep your focus. Look at this. Okay, this is our NCLEX simulation room, and this is our classroom. So once again, we want you to pass your test. So I'd like to see you join us in our next generation NCLEX RN Flex program, the most flexible test preparations class for the NCLEX RN. So it's your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, our QBank with very simple rational, the 3 books that are given for free, then the NGN strategies, and you can join me for free for my 3-day quick fix sessions. It's usually 8 hours a day for a very minimal fee of $3,499. Give us a call so that you can avail any of these at minimal cost. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day, keep your NCLEX RN fears away. See you not in my next video. I'd like to see you in my class. Take care. You're gonna be the next US RN.